Jade House is a unit where we provide care for families where one of the parents has been diagnosed with postnatal depression. And postnatal depression is depression that occurs in the 12 months following delivery of an infant. Depression can occur, of course, at any time in a person's life, but tends to occur at pivotal points in people's lives. And after the birth of a baby is a pivotal point in a woman's life, a point when she can be more vulnerable and more prone to experience feelings of depression. Well, some women that attend Jade House have had previous episodes of anxiety or depression, but it's certainly not always the case. Sometimes they may have had an episode of depression which they only recognise as having been depression after they attend here and receive a diagnosis and treatment. And they sometimes identify a period in their life earlier when they say, I think I was depressed then. But sometimes too, for women this is the first time they've had these kinds of feelings. And it can be quite a shock sometimes when their image of motherhood is quite different. If you are struck with depression, then it's not the prescription that you've perhaps come to expect. Well, at Jade House we do provide individual counselling and therapy, and the form that takes can vary depending on the client, depending on the clinician, depending on the kind of relationship that gets struck up between the two. So there's a range of counselling techniques that might be applied, ranging from cognitive behavioural techniques to more emotionally based therapies. It just depends on what the individual client's needs are and what the clinician's preferential style is for working with depression. We also offer a day stay program which has multifaceted benefits for women. Some women attend day stay more for the practical aspects of parenting, the sleeping, settling, and the regulating of the infant, which of course makes her life a whole lot easier and her depression more workable to treat. Some women attend day stay simply out of sheer exhaustion, and it's a place where they can actually receive some respite and catch up on maternal sleep deprivation. Day stay also has a very powerful social impact on women's lives. You've probably seen yourself today that some women feel completely alone in the house with their children, and that's not helpful to the resolution of their depression. So coming here and feeling as though they're not the only person in the world that's not coping can be a tremendously therapeutic phenomenon for some women. What we have here is the capacity to support a mother in her role as a mother and to guide her in a way that enables her to become the kind of mother she wants to become. But perhaps depression is holding her back from that a bit. And in supporting her, she discovers things that she can do and be with her infant that enrich the relationship. At the end of the day, the aim is for the both of them to have a good time together, because when people are enjoying being together in a relationship, it's much more likely that they'll seek each other out and be good to each other, and that's true of any relationship. But so part of our role here is to nurture that relationship in a way that it becomes a positive thing, both for the mother and for the infant. With depression, you usually will experience a conglomerate of symptoms, but one of those might be sleep disturbance and eating disturbance, appetite, emotional lability, cheerfulness. There's a whole range of things, but you can imagine that if you're already sleep deprived from getting up to feed a baby, you've just been through childbirth, and in addition to that, you're not going back to sleep perhaps because you have depression, lying awake at night, and then you have to get up and all day long meet the needs of an infant who is somewhat mysterious in the signals that the infant is giving out. It may be a very new skill if it's the first baby. And so all those things just get that much harder to manage when you're sleep deprived. The distress element comes into it too, because when you're sleep deprived, it is much harder to regulate distress. And that's true of an infant as well.